Hello everyone, this is Dr. Anmol Mishra from Radiance and IRAD, and we are going to reveal the answer to the question that we had posted a few days ago. And the question was what you can see on your screen right now. If you see here, this patient was a diabetic patient and had undergone a pars plana vitrectomy. So there's a history of a pars plana vitrectomy that was done for a previous episode of retinal detachment. Now, this patient had undergone a CT scan for some other unknown reason, actually some unrelated reason, and that was because there was a trauma to the head. However, after proper history taking, it was revealed that there was no trauma to the eye, and besides we could not find any periorbital soft tissue swelling either. So there was no history of direct trauma to the eye. And so when this patient came to us, we could see this hyperdense eye here. So this hyperdense eye was basically because of some other reason. So it is non-traumatic. Now what is the reason? So to find that the reason, we have to carefully look at the picture. So what do we see in this normal eye first? This is the anterior chamber, and up to here is the anterior segment, that is up to the posterior surface of the lens, and behind that what we see here is the posterior segment. So this is the posterior segment, and this is the normal eye. Now if we look carefully here, and the hyperdense structure in the left normal eye is the lens. So if we look carefully on the other side, what do we see? We cannot directly delineate the lens here, but if we look carefully, maybe this could be the lens, but it's not very conspicuous here, so we won't comment on it. What we have to see here is the anterior segment and the anterior chamber. Anterior chamber appears normal, and on the other hand, in the posterior segment, we can see that there is this, it is uniformly hyperdense. So the posterior segment is uniformly hyperdense. Now when we took the history properly on the operative note, we could realize that there was pars plana vitrectomy with SOI, and that is silicone oil implantation. So there was silicone oil that was injected into her posterior segment as a substitute for the vitreous, so that the eye can maintain its normal pressure. So that is a routine thing that is done in pars plana vitrectomy, and that is this silicone oil implant or silicone oil infusion. So silicone oil was given as a vitreous substitute, and it is seen that silicone oil is characteristically hyperdense on CT. So silicone oil is hyperdense on CT. So this is basically silicone oil. And if we talk about the HU, then it is said that the HU is approximately 110 to 130, but there is no hard and fast rule. It can actually range from 50 to 130. So the HU can be somewhere around here, and the closest differential of intraocular silicone oil is definitely, as many of you have also commented, is vitreous hemorrhage. So there is another possibility that lies in this case, and that is there is a vitreous hemorrhage post pars plana vitrectomy. But even if there is a vitreous hemorrhage, the silicone that has been implanted or that has been infused here is going to stay hyperdense. So that is not going to go anywhere even if there is recurrent hemorrhage here. So this homogeneously hyperdense area is more likely due to silicone oil. that has been implanted. There is another characteristic feature that is seen with silicone oil and not seen with vitreous hemorrhage, and that is this. If we look here, then we can clearly see that there is this small hypodense crescent. Okay, I'll show it again to you. If you can clearly notice here, there is a hypodense crescent here, somewhere around here. So this hypodense crescent is basically because this silicone oil, basically being oil, it has lower density and so it floats on the residual vitreous that is present here. Though it's not very clear here, but this homogeneous hyperdensity, there are certain features that can help us differentiate between a vitreous hemorrhage and intraocular silicone oil on CT scan, though it's not very clear or not very definite, but still there are features that can help us differentiate. So if we try to differentiate between the two, so on one hand we have vitreous hemorrhage, on the other hand we have intraocular silicone oil. So it is said that vitreous is usually more heterogeneous though hyperdense, and this is more homogeneous. So both are going to be hyperdense, but this is the difference. Usually the HU is between 50 to 90 in case of vitreous hemorrhage, whereas in case of silicone oil it is usually around 110 to 130 HU. But again, as I said, there's nothing absolute here. And lastly, the crescent that I showed you, this crescent is absent in a vitreous hemorrhage, whereas that crescent is present here. So there is another feature that can help us, and that is you can go for a prone imaging. In case of prone imaging, since the oil is less dense than the rest of the remnant vitreous, so the oil will move in the non-dependent part. So that is what happens here. Now that is what happens, but the most though there are these differences that you can look at, the best way to differentiate is definitely one thing, and that is history. So you have to have a clear idea about what has happened with the patient. If the patient gives a history of pars plana vitrectomy, the patient is a diabetic and giving a history of pars plana vitrectomy, and you get this homogeneously hyperdense posterior segment with normal anterior segment, then you should again always think of silicone oil implant in the eye. So this is basically because of intraocular silicone oil, and that is the answer to the question, with vitreous hemorrhage being the closest differential of the same.